What is euthyroid 6 syndrome and thyroid tests? Imagine getting your thyroid tests done and seeing results that seem off, but your thyroid gland is actually healthy. That's where euthyroid 6 syndrome comes in. It's a condition where thyroid function tests show abnormal results, but the thyroid itself is not the problem. Instead, these changes happen because your body is responding to a serious illness or stress. It's also called non-thyroidal illness syndrome. This syndrome often occurs in people who are very sick with infections, trauma, surgery, or other critical conditions. When your body is fighting an illness, it adjusts how it handles thyroid hormones. The main change is that the active hormone called T3 or triiodothyronine tends to be low. The levels of T4, which is a precursor hormone, are usually normal or slightly low. Meanwhile, the thyroid-stimulating hormone, which tells the thyroid to produce hormones, might be normal, low, or only slightly high. Sometimes, a hormone called reverse T3, which is an inactive form, is elevated, but testing for this is not common in routine practice. The reason for these changes is that during illness, your body reduces the conversion of T4 into T3 and alters how thyroid hormones bind in the blood. These adjustments are thought to be protective, helping your body conserve energy during severe stress. Because of this, the abnormal thyroid tests do not mean your thyroid gland is failing. Instead, they reflected a temporary response to your illness. It's very important to distinguish euthyroid 6 syndrome from true hypothyroidism, where the thyroid gland itself is underactive. In hypothyroidism, TSH levels are usually high, and the thyroid gland is not functioning properly. But in euthyroid 6 syndrome, TSH levels often stay normal or only slightly change, and the gland itself is healthy. Most of the time, treatment focuses on managing the underlying illness. The abnormal thyroid test results usually return to normal once your health improves. Giving thyroid hormones in this situation is generally not recommended because the low hormone levels are an adaptive response, not a deficiency. Providing extra hormones may not help and could even be harmful. This syndrome is common among hospitalized and critically ill patients. It appears in about 3 out of 4 people with severe illness, including those with pneumonia, sepsis, heart failure, liver or kidney disease, and even COVID-19. Recognizing euthyroid 6 syndrome is crucial because it helps avoid unnecessary treatment and ensures that the focus remains on recovery from the primary illness. In summary, euthyroid 6 syndrome is a reversible change in thyroid hormone levels caused by systemic illness, not by problems with the thyroid gland itself. It's a sign that your body is responding to stress, and understanding this helps doctors interpret thyroid tests more accurately. Always consult healthcare professionals for proper diagnosis and treatment, especially when dealing with complex health issues.